welcome to our first vlog. My name is Mary and I host vlogs for Cadence Physical Therapy. Our doctors have been doing such a great job, and we would like to show this information to social media as well so that we can let them know that we are always here to help them out. So here's David Thomas, Dr. David Thomas, to tell us more about what to expect during their first consultation. Hi, David. How are you?
Hi, Mary. I'm doing pretty good. Thanks for having me on for the video. I appreciate that. So yeah, just a little bit about myself. I've been working here at Cadence Physical Therapy going on for about 15 months now. I recently got a specialization as a pain-free performance specialist. So just a quick little information about that. So now I'm able to incorporate a little bit more higher level activities for patients that are looking to go back to the gym or go back to like more intense workouts. So able to combine all the things I learned in physical therapy school with a little bit more, I would say, almost like a personal trainer type mindset to get people back to a higher level of function.
Wow.
Yeah, that's just a little history about me. 14 months here. And so back to your question, Mary. You asked me about what a patient might expect on their first visit at Cadence Physical Therapy. Is that correct?
That's right.
Okay, very good. So, upon coming into the clinic for the first time, you're going to be greeted by our lovely front desk, Boriana, or she goes by Bobby. That's her nickname, so whichever you prefer. And she's going to welcome you guys aboard. Anyone that comes in, there's going to be some paperwork to fill out naturally at any clinic, of course. Just getting some basic information, insurance, reason why you're here. Have you been for therapy before, insurance and all that fun stuff. So once beyond that point, once the information's filled out, you're going to be greeted by your physical therapist, whether that's myself. And again, my name is Dr. David Thomas. We also have Ryan Towns, and we also have Crystal as well. So there's three of us working here at Cadence Physical Therapy. So you'll be greeted by your therapist. You'll be brought back to one of the treatment rooms. The treatment rooms are sanitized before and after every session. Chairs, tables, equipment, everything's been sanitized. So we do take some time in between, a couple minutes in between sessions, just to make sure that everything's up to the CDC orders. We do wear masks at the clinic. Luckily, I'm done with my patients for the day, so I get to finally take this thing off. But we do abide by the guidelines with wearing the mask and keeping a 6 feet distance when possible with our patients. So upon coming in for your first initial evaluation, we're going to ask a little bit of information, of course, a little bit of history. Have you had this problem before? How long have you had it for? What is the problem limiting you from doing that's most important to you, whether that's functional? A lot of times I'll hear things like, oh, I can't go for a walk with my wife anymore. I can't play with my grandkids.
Okay.
So pretty meaningful things. It ranges from something, I want to go for a walk for 10 minutes. And I have some patients saying, I want to go back to doing a marathon when COVID's over. So we have a wide variety of goals, and we always incorporate the patient's goals along with what we deem to be functional and how we're going to get there. So we find limitations. We of course, we look for flexibility. We look for any weakness. A lot of times that's balance. We also like to, we wear gloves, but we like to place our hands on the patient because there's no better way to really get a feel for a muscle injury
Okay.
Yeah, absolutely.
Wow.
So we do a pretty thorough approach in terms of how we assess where the problem's coming from, try to give a clear
Understanding.
Yeah, exactly. If I'm rambling too much, let me know. I talk a lot, so if you want to move on.
No problem. Thank you for letting us know. Yeah, of course. Because with that said, then the people will know that we offer a variety of things. People who love to work out, people who love to be active, and people who are probably going down the road of really trying to rehabilitate themselves. And that's a good thing.
Absolutely. And we do everything in our power to empower our patients. We want them to know that they are in control of their situation. You don't have to go to surgery as a first option. You don't have to be hooked on opioids. There's a massive opioid epidemic happening in this country right now. Unfortunately, a lot of physicians, if someone says they have pain, the first thing they'll do is write a prescription for painkillers. And that goes down a dark road. And we like to see physical therapy as a way of treating the true source of the problem, right? So sometimes getting those painkillers, going on prescriptions, or even, I don't want to say anything about the chiropractors. There are some amazing chiropractors out there. But sometimes people are only getting a Band-Aid for a wound that needs stitches. And I like to consider what we do here at Cadence Therapy as the stitches to healing the wound rather than a Band-Aid that you have to keep replacing on and off.
That's awesome, David. So when they go home, do you also provide them exercises that they can do?
Absolutely. Every single patient leaves here their first day having an exercise program. We update that routinely, usually once every week. We'll take time in either our downtime or when we're at home to send them an updated home exercise program with access to videos, pictures, descriptions, and how often they should be doing them and how long. And so we stay in constant communication with our patients via email with weekly exercise program updates to make sure that they continue to progress.
That's great. And when can I expect functionality and improvements if I go there on for the next couple of sessions?
Sure, I think that's a great question. What to expect and when to expect it. So of course, returning to function is like the primary goal for, I would say, the vast majority of patients. They're either coming for pain or a lack of function. Those are the two reasons people come see physical therapists. So that varies. It really varies a lot. There's a lot of variables. Whether the patient has been active before, is this their first time being physically active? How long have they had the problem? How severe is the problem? I mean, we've had patients that we've been able to successfully rehabilitate in as little as like 2 to 3 weeks.
Oh, wow.
And we've also had some patients that, might need more therapy like 3 times a week for 8 weeks, or if they're post-op surgical, sometimes as long as 12 weeks. So, it really depends on there's a lot of factors that go into it, but we obviously aim to try to get them out of the clinic as soon as possible and back to what they want to do as soon as we can. That's the goal.
Yeah, and that's a great thing that you are educating all of the viewers, including myself, about what physical therapy is all about, because some people probably are afraid to get a consultation because they don't know what to expect.
Yeah, it can be a little intimidating. I know there's a lot of there are a lot of misconceptions about what a physical therapist actually does. I know a lot of people commonly think that, we just do massage. We're just glorified massage therapists. And yes, we do. We do include forms of manual therapy, which is different from massage. And also another misconception to debunk is we treat people from all levels of functionality. We don't just treat people who've had strokes or people who have, Parkinson's disease. I've treated very young athletes I treated a mixed martial artist who wanted to get back to fighting. And then my next patient was someone who's been battling Parkinson's for about 10 years. So no matter what degree or function you are, there's no one that wouldn't be appropriate for physical therapy if they're suffering either from pain, injury, or lack of function. So we see all kinds of levels of functionality here at the clinic.
That's awesome. And that's why I'm seeing a lot of really good reviews about Cadence in the Google Business Review. And thank you so much for helping them out, because that really says a lot of things about you and the team.
Yeah, thanks. I appreciate that. Here at Cadence Therapy, we take a lot of pride in obviously putting the patient first. And we just want to make sure that they're getting the best one-on-one dedicated care they can. Also just want to mention that here at Cadence Therapy, we do 45 to 60-minute one-on-one sessions. You're never with a physical therapy assistant. You're never with a technician. So you're always getting that undivided attention to make sure that everything you're doing is proper, correct, and adjusted as needed every second you're here. So we take a lot of pride in what separates us from, your standard more corporate clinical setting where you might be tossed between 3 different people at the same time. The therapist has 2 other patients. We see a huge difference with that one-on-one sessions with these patients.
And it looks like I'm very comfortable talking to you. So let's proceed with, if I come in with a heel pain, how does the consultation run? So let's say you interview. about
Sure.
my
Okay.
heel pain.
So, you want to do a quick mock interview then? Heel pain.
Yes.
Okay, Mary. All right, Mary. So tell me a little bit about your heel pain. I want you to describe to me what this heel pain feels like for you.
Mm-hmm. It's been a bad pain because when I go for a walk in the treadmill, even just a walk, it stings. And being 37 years old, I think this is about me using my feet for long periods of time, wearing high heels, and running because I used to run before.
Okay. Okay. And how long have you had this problem for? Is this a new problem or have you had this in the past?
Yeah, it comes back when I do hard training, but it dies down when I'm resting and I'm not doing hard physical activities.
Okay. So you mentioned a couple things to me already, Mary, that seems like you might be a little bit limited in, which is it sounds like running or higher level activities you're not able to do because the pain becomes
So
intolerable. Is that
yes, yes,
okay?
you're right.
Okay. What are you doing currently, if anything, to help with your heel pain?
I have this lacrosse balls, and there are exercises on the balls that I use, and sometimes I get an ice bag and roll my foot or my heel on it, and it gives me a relieved feeling. It does help.
Fantastic. You've done some good research because that is a very good self feel and deal with some of the inflammation and pain. That's something that I would, without a question, recommend to you. Okay. So going on from here, I want to ask you, so what would be, you mentioned a couple things that you do, a couple activities that you can't do, or at least having a hard time. What to you, Mary, would be the most important thing to get out of physical therapy?
Hmm. To be able
For you,
to run again.
to be
Um,
able, okay.
21 miles of running. I miss that, the high of running. So
Yeah, you're a go-getter. I get that. The runner's high, of course. I've experienced that myself. So, so what I'd like to do next, Mary, is now that I've gotten some decent background information, I did want to ask you one more question. Are you wearing, what type of shoes do you typically wear throughout the day?
mm-hmm. Throughout the day, just sandals because I work from home, or slippers. And when I go work out, I bought a good shoe for running. And sometimes
Mhm.
I use the one with spikes because I have a tendency to really run fast when I'm on the high. So when I'm doing that, I use the ones with spike to protect my feet.
With spikes. Okay, so are you running on grass?
No, I'm running on a treadmill, but sometimes depends on where I am. The treadmill doesn't have that soft impact feeling, so I wear the
Mhm.
ones for mountaineering. That's so that it would really protect my feet.
Okay. It sounds like you're wearing some pretty decent shoes when you're active, which is the most important, especially when you are going to be doing potentially pain provoking activities. You're wearing the best shoes you can. There's one more question before I move on to examination. Do your shoes that you wear, you mentioned you wear Nikes, do you have any sort of insole padding or any sort of arch support in your shoes?
Oh, good question, because I've heard about that and I think that's also helpful, but I haven't gone into that.
Okay. Okay. Well, that's definitely something we can look into after examination. We can take a look at your shoes, and I can tell you if the ones that you have, because some Nikes and other Adidas shoes do come with really good arch support, but there are many that are more of that flat type of curvature shoe that don't have the support, and that could be an issue. But we can look at that later. So moving on to the examination, for the next thing I'd like to do is I'd like to just look at some range of motion
Mm.
of your ankle. So we will do some motions up and down, side and outside, and now look for take range of motion with a goniometer, which is just a fancy term for a ruler to measure degrees of motion and see if we find any limitations or maybe excessive motion. A lot of patients, typically you think of physical therapy, oh, I'm stiff, I'm stiff. Some people have too much mobility in their feet, which can create instability and can create pain. So,
Oh.
so sometimes there is too much of too much of a good thing that can actually be harmful. Uh,
Oh, okay.
okay.
So when can I expect to be able to run as hard and as long as I want?
Okay. So I can tell it sounds like you want to get back to running as soon as possible. Is that correct?
Yes, very much so.
Fantastic. Being an athlete myself, I always want to bounce back from an injury as soon as possible. So, firstly, the best way we can handle that is by getting you to commit to therapy for 3 times a week for several weeks. We can go from there at the end of those 4 to 6 weeks and see where you're at. Sometimes as long as 8 weeks, but as I mentioned before, every patient's response is a little bit different. And it sounds like you're a patient who'd be very compliant with the home exercises I would give you, which is going to facilitate a much faster recovery, because I'm only going to be with you 3 times a week for 45 minutes, but you're with yourself for the remainder of those hours in the week. So we'll work on a team together and see how long we can go. But if we're shooting for just a rough estimate based on my expertise, this can be addressed appropriately in as little as 4 weeks, especially if we keep that frequency up to 3 times a week.
That's perfect. So what will happen now that you know everything about the pain I'm experiencing? What's next?
Sure. So in terms of my examination, because there's definitely a lot more I would look at besides range of motion.
Okay.
Yeah. So a couple more things I wouldn't want to drone on too long, but a couple other things that I would look at is muscular length limitations. A lot of times with heel pain, you'll find that the heel cord or the calf muscle, so I'm just going to come out here, calf muscle through here, ends up being a little bit stiff in people with chronic heel pain. So some stretching might be involved. We might be doing some soft tissue work to help release those adhesions. A lot of times there can be scar tissue, especially if this isn't the first time you've injured it, as you mentioned it. More times than not, there tends to be scar tissue that adheres to muscles, the ligaments, the tendons, and that can contribute to future injuries if that's not addressed. So we already mentioned range of motion. I'd look at some joint mobility to see if there's anything that's stiff or too mobile, too much movement. We're going to look at strength of the ankle, strength of the knee, and the hips. A lot of times ankle problems are actually caused from the knee or from the hip. And it gets a lot.
Wow, that's enlightening. I didn't even know that.
Yeah. Many times in rehabilitation, you see, okay, I have an issue at my foot. Something's wrong with the foot. More than likely, probably something wrong with the foot. But we need to look up and we need to look down away from that area. Sometimes at the toes, sometimes underneath the foot. Sometimes we go up to the knee, and sometimes we have to go as far as the hip. With weak lack of stabilization anywhere above or below a joint, that can lead to issues in a place like the heel. So we're going to look at strength. I definitely want to look at balance. Balance is a key factor.
Okay. Yeah, I understand.
I want to look at your foot position. Is it cave in? Does it cave out? Is it neutral? Are you compensating? Is the alignment of your feet correct? Is one leg longer than the other? Right?
Okay.
And then last but not least, you're a runner. So of course, we're going to do a runner's assessment. I'm going to get you on a treadmill. We are going to provoke some of those symptoms because we want to see what exactly is provoking those symptoms and what is occurring in your body, in your chain, the shoulders, the neck, the spine, the hips, the knee, the ankle, the toes. Where do I see something going wrong visually? And we're going to review that together, a video from the side, from the front, and from the back together. And we're going to go through this together to figure out what the problem might be when you're running.
That's a very intricate and scientific process. I like that. I wish we have like physical therapists as very, very close by, because I would go now and have my consultation.
Well, I'm glad. You guys don't have a physical therapy clinic close by to you guys?
No, unfortunately, especially because of COVID. So that's something that has been limited in our city. But that's great, David. Thank you so much for that. I'm sold.
Oh,
I'm sold to
fantastic.
the idea.
Will you be tomorrow? Does 1 p.m. work for you?
Yes, absolutely. It would be fantastic to come back and finally be able to run again when just the same way I ran when I was 21.
We can try to get you there. We will sure try our hardest to get you there together. So, yeah.
That's amazing. So, David, tell everyone on social media what type of specialization Cadence caters to and what time you open and what the other things that they will be expecting from you and the rest of the team.
Okay, I'm going to try to go through all of that, making sure I memorize it. So we see a wide variety of conditions here at Cadence Physical Therapy. We see commonly vertigo, BPPV, which is benign paroxysmal positional vertigo. A lot of people consider that like dizziness. Sometimes dizziness can be caused from a variety of issues. So vertigo, dizziness, BPPV. We do see a lot of post-op surgical patients like lumbar spine fusions, hip replacements, knee replacements, anything along those lines. A common one we see is a muscular strain. Very often it's lower back. Most of the patients we see, and really any physical therapy clinic sees, is low back pain. It's the most common seen issue in the clinic. So any musculoskeletal disorder from the bones, the joints, the muscles, we treat that. Arthritis is another common one we see. Stenosis, sciatica, IT band syndrome, piriformis syndrome. We do treat neurological conditions as well. So we do have Parkinson's patients. We even treat pediatric patients, actually. I don't know that we advertise this as much as we should, but I actually spent a good time in my last clinical rotation working with children as young as 3 months old who had torticollis, which is stiffness or contracture of one side of the neck from being inappropriately, all the way up to 14 years old. We'll treat autism patients, ADHD, toe walkers, developmental delay. In terms of the pediatric, currently, and we're currently treating post-pregnancy.
Oh, wow.
So after a pregnancy, obviously over 9 months, tissues are being stretched progressively over 9 months. So a lot of times you'll see abdominal or core weakness, pelvic pain or pelvic weakness. So I even have a young patient right now about the age of 30 who is unable to do a sit up from the bed and has to use both of her hands in order to pull up because of all that core weakness that occurs.
Oh.
Yeah. So pediatric, neurological conditions, orthopedic conditions, every orthopedic condition under the sun. But yeah, those are some of the issues we treat here at Cadence Physical Therapy. What was your next question? I'm sorry, I get pretty into my answers.
Yeah, that's perfect. So our next, what we would like people to know is the times you are open, and then invite them to come visit Cadence Physical Therapy.
Of course. So we're open Monday through Saturday. Monday, Wednesday, Thursday, and Friday we're open from 8:30 a.m. to 7 p.m. On Tuesday, we're open from 8:30 a.m. to about 4 p.m. Tentatively, we are willing to extend those hours from 8:30 to 7 p.m. like the rest of the work week, pending we have the demand for it. On Saturday, we are open from 8:30 a.m. all the way until 1 to 2 p.m., depending on the patient. So also variable for that. Sunday is the only day that we're closed. So we obviously do cater towards, with longer hours in the morning and towards the evening, to those 9 to 5 patients who have to work a job or a little bit too busy. So we want to make sure we can see every demographic, working population, retired population. So we want to make sure we can help everybody out in the community.
Looks like Cadence is really a helping type of clinic and establishment, and then people should come by. Do you think that the patients who come by are just close to the area, Buffalo Grove, or do you see other people who come by?
No, we've developed a pretty good reputation that we do have people driving much further than Buffalo Grove and Arlington. We're located in Buffalo Grove. We do have a good portion of our patients coming from local areas, Arlington Heights, Buffalo Grove, Deerfield. But I have patients that live as far as me, commuting all the way from Chicago, all the way from Skokie, which are 30-plus minute drives. I even have a patient that's commuting all the way from Indiana, a 2-hour drive to come see me. So we're traveling statewide to come get treatment from us at Cadence Physical Therapy. So we are very humbled by the fact that we've developed a good enough reputation that we are worth the drive. So we take a lot of pride in that for sure.
That's great to know, David. So people should come by when they are feeling pain and see you and the team.
Come see us. Come see Boriana. Come see Ryan. Come see Crystal, myself, David, and come meet the whole team. We're looking
Oh,
forward to you guys.
yes. I wish to be there soon and hope to get my heel pain treated.
Fantastic, Mary. I look forward to meeting you on your first visit.
All right. Have a great day, David.
You as well.
Bye
Take care,
bye.
everybody. Bye.